We've always had the same amount of clients in our programs, from 33 Highlands to 66 Clinic, but participation in clients has improved. Clients want to be out and about more. Clients are more willing to go out in the courtyard. Clients are more willing to go out on outings. The Kensington Garden really does give the opportunity for clients to intermingle with each other and gives them the opportunity to be social. I feel like Kensington Garden is kind of now the central base of residential. We have our psychiatrist on unit, we have our nursing supervisor with nurses, we have our clinician that other programs are now welcomed into this brand new, beautiful facility. CMHA in itself is a very developed agency, and where we were located before, it didn't feel like CMHA. Kensington Garden feels like CMHA.
The courtyard is perfect, the dining room is perfect. We have 3 chefs, 3 cooks that cook for us, and I love it here. I love the staff here. You know, I love the program administrators, how they operate things, and it's, you know, casual, come as you go. And the groups here are fine. The rooms are spacious, so.
From a design standpoint, we really focused on creating neighborhoods so we could build a sense of community from the architecture throughout. We really wanted to have features that inspired connectivity, were personal, and yet had a sense of place. Wanted the rooms to feel like apartments for the clients. You know, this is my apartment, this is my door to my apartment, it has my apartment number on the side, and et cetera. So we designed this building for them. It's not our building, it's designed for them. And so it makes me smile to know that they feel at home here, and they've moved right in and made it their own. So.
One of the biggest things about CMHA is its location. So the fact that we're located in New Britain and in Waterbury speaks volume, because usually the disenfranchised community doesn't really get much resources or help. I think we've done a really, really good job at outreaching, partnering up with different people in the communities, hiring staff that are a representation of the communities that we serve. So I think overall, we've kind of found different ways to help our target population. So Diversity Committee, just by its name, I think the people in Diversity Committee are also pretty diverse, whether it is the role that they play, whether it is, what they look like and their backgrounds. And so when we all come together, whether we're in a leadership, whether we do more tech, or whether we are clinicians, we're able to talk about what we can do as a whole to help our clients.
CMHA is absolutely a critical partner of ours. I think we all do what we do best. It's our specialty. And we can't be everything for everybody. And so if we partner together with strong relationships, then we can all be the best that we can be. And if we work together, what a mighty team we make. So as we find people on the street who need a little bit extra resources, we can call in the CMHA teams, have them meet people at overflow or outside, even come into the resource center. We have a room, we call it the community room, community partner room, and I think it's probably most used by CMHA. I think it's fantastic that we can call on somebody at CMHA. We can figure out what the best team is to work with the individual we're also working with. It's also nice if we have a relationship with somebody, we can say, I want you to meet my friend, somebody that I work closely with. I trust them. They work at CMHA and I trust them and they're going to do right by you. They will take care of this. They will help you as well.
When you have agencies that actually work with people in the neighborhood, people that's doing the groundwork, that says a lot about that organization, man, because they can just take it from their people and say, well, this is what we're here going on. No, they want to hear from the people that's actually in the neighborhood, doing the work, right? And they want to say, how can we assist you? The old saying is, give a man a fish he'll eat for a day. Teach him to fish, right? So CMHA is saying, hey, we want to help teach you guys how to fish, but we also want to give you or leave you the fishing rods, the tackle, so you ain't got to keep relying on us. How can we help you help your neighborhood fish? What do you need from us? And they're willing to give. You know what I'm saying? Not too many people are willing to give. A lot of people want you to keep being dependent on them. CMHA is like, hey, what do you need? What do you need? Here you go. If we can't get it, if we don't have it, we'll see how we can get it together.
CMHA has always been an active part of the community in Waterbury and New Britain, but ever since COVID, the needs of our children and adolescents and their mental health has really been prioritized. And so here in Waterbury, we actually don't have a wait list for any clinic-based services, which is pretty incredible. You don't see that everywhere. So that's a way that we really try to prioritize the mental health needs of our children and adolescents. This space is really special because we've waited a long time for it. We used to have our extended day treatment program upstairs on the 4th floor with all of our other services. And so now this is a private, newly renovated space so that our kids can really have a space that they can make their own. The staff can make it their own. And the idea was really to make it a space where the kids want to come back. After COVID, a lot of child services were really in demand, and they still are. And so our extended day treatment program is actually one of the only clinic-based services outside of an IOP level of care that really offers the mental health and behavioral treatment that our kids need. And so to be able to provide them with those services here in our newly renovated space, we can definitely allow for greater access, and again, like that space where the kids really want to come back.
So Epic has transported us into like this whole new world, right? So we're in this place now where we have a whole new language, we have new customs, we have new resources, and at glance it's just like this new electronic health record, but it's really been so much more for everybody else. So we had a 6-week period in outpatient that we planned to kind of roll out and slow down services, and eventually at the end of the 6 weeks go back to full services. So in outpatient, some things slowed down, some things didn't. I mean, huge shout out to our intensive outpatient, or IOP program. I mean, they kept going from day one of rollout. They had to present at higher level of care for our clients. As we were slowing down services, we were doing so much on the back end, and some staff really kind of stepped up into leadership roles as they saw that this was a strength of theirs, and staff were taking the lead and helping others. It was just kind of a beautiful thing. Even though we were all struggling, it really just kind of emerged that amazing teamwork, and I'm really proud of a lot of the staff and what they did there.